Good morning, and this is yours truly, Dolphy Alexander Gilpin, coming to you from Decatur, Georgia, United States, 1524 Lavista Drive in Decatur, Georgia. It's approximately 5:55 a.m. That is 5:55 a.m. here in Decatur, Georgia. And we're continuing with our brief analysis on hematologic disorder. And in previous videocasts, we described the condition of thrombocytosis or thrombocythemia, which was an elevation in the thrombocytes count or platelets count. This morning we are doing thrombocytopenia, which is below normal or decrease in the platelets count throughout the circulatory blood system. Once again, we are here by our OMax microscope, which is assisting us in our research and analysis in medicine in a comprehensive fashion, not only in hematology, but microbiology and all the various fields that's relevant. But let's continue now. We are talking about thrombocytopenia. And we have stated previously that now 150,000 to 450,000 was a case of normal platelets count. And that also depends on male and female, pediatric, adults, and neonatal cases in which there's variation for the normal count. But here I have no thrombocytopenia. And below 150,000 platelets per microliter of blood would be considered a condition of thrombocytopenia. Now, one of the main symptom of thrombocytopenia would be internal bleeding, internal and external bleeding. And it's sometimes bleeding from the nose, continuous bleeding from the nose, from the gums. You have a lot of bleeding from the gums, bleeding from the rectum. Other symptoms would include blood spots coming out on the skin, purple, red and brown discoloration of blood spot. Now the blood is made up of, as you know, three major blood types, which is the RBC, the WBC, the white blood cells, the red blood cells, and the platelets, for which we are focusing on this morning. Clearly, yes, we're focused on the platelets. And as we said, no, 150,000 less than would be the case for thrombocytopenia. And causes of this thrombocytopenia could include bone marrow diseases or treatment of the disease. So not only the disease can cause it, but by treatment of the disease, sometimes you get these condition of thrombocytopenia. Disease such as leukemia which is bone marrow and blood marrow and blood plasma. Cancer, yeah, leukemia, which is it's a cancer of the blood normally. See a cancer of the blood or bone marrow. Yeah, so the case of the disease leukemia can lead to thrombocytopenia. Lymphoma, which is cancer by the lymph system and bone marrow. It affects the bone marrow as well. This can lead to the condition of thrombocytopenia. Aplastic anemia, and in aplastic anemia, this is a disease that prevents the bone marrow from making cells, or making all type of blood cells. So the aplastic anemia prevents the bone marrow from making all form of cells, which is known as RBC, the WBC, and platelets. That would include other form of cells, stem cells as well, but we are focusing on the platelets. So for thrombocytopenia, the aplastic anemia prevents the bone marrow from making the platelets. Also, we have to destroy the platelets before we get the condition of thrombocytopenia. The man-made treatment of the disease, the radiation and chemotherapy. Radiation and chemotherapy. This destroys now the stem cells, which later becomes major cells, RBC, WBC, or RBC standing for red blood cells, WBC, white blood cells, and the platelets, or thrombocytes. So the radiation and chemotherapy treatment help to destroy these cells, and in particular now we are focused on the platelets. So if it does destroy the platelets, then we get the case of thrombocytopenia. With radiation chemotherapy, it destroys all type of cells there, but in particular now the platelets. Since we're focused on the platelets for thrombocytopenia. Now, exposure to certain viruses also causes thrombocytopenia. Exposure to the Citomegalo virus, the Epstein Barr virus, HIV, and hepatitis. All these disease condition virus can cause the condition of thrombocytopenia. So we write now the hepatitis, CMV now for cytomegalo virus, we're just sort of bridging. And HIV, those conditions can lead to thrombocytopenia. And the Epstein Barr virus. Of course, it's now the EBV. Now, in the case of immune thrombocytopenia, the body's immune system attacks the body. And this can also lead to the case of, if we shorten it here, abbreviated ITP, immune thrombocytopenia. So, when the immune system attacks the body itself, then we could get the case of thrombocytopenia. An enlarged spleen, can lead to the case of thrombocytopenia. The enlarged spleen, what happens is it traps the platelets and prevents the platelets from circulating in the transport blood system. And so if we prevent platelets from being transported, then there's a reduction in the platelets count, and that's lead to the case of thrombocytopenia. So we have enlarged spleen. What is that? So also in splenectomy, when they remove the spleen, this can not only lead to thrombocytopenia, but a disruption in any bodily organs, and in this case, the spleen can also predispose the body system to other type of disease, and so thrombocytopenia can be set in. We have no exposure to toxic chemicals. Exposure to toxic chemicals. This can lead to thrombocytopenia, or just TP, and ITP meaning immune thrombocytopenia. No bleeding internally and externally, and bleeding can occur on the surface of the skin or inside the body. And in mild cases of thrombocytopenia, you know that can be like symptomless. Now, bleeding from various parts of the body, including the skin, with red and purple, brown purpura or petechiae on your lower legs, or burning leg, or burning that is purple or red or brown, can cause the purpura. Continuous bleeding that does not stop on its own, such as nosebleed, bleeding from the gums, and when you brush your teeth, you see bleeding. That can be a sign that you're losing your platelets, or that there's a reduction in your platelets count, and this causes this continuous bleeding. Internal bleeding from the urine and from stool and from the rectum. That can also be signs and symptoms of thrombocytopenia. Now, the treatment of thrombocytopenia. In the treatment now, we sometimes treat the disease condition or the disease causing the thrombocytopenia. So, of course, your treatment, we treat the condition causing the thrombocytopenia. And know that thrombocytopenia can be treated with corticosteroid drug, steroids and corticosteroids, and other medications. And this treatment itself can also cause other side effects. As we know, most drugs, sometimes antibiotics and other drugs, can cause side effects. We can also treat thrombocytopenia by what we call platelet transfusion. In the case of very low or extreme platelets count, you have a platelets, platelets transfusion. And splenectomy, that is in the treatment, or removal of the spleen. So when we remove the spleen, or in the process called splenectomy, but this also places the patient at higher risk for infection. And so certain vaccination has to be given before the splenectomy can be done to prevent the infections. So we have gone through treatment, we have gone through a description, we have gone through conditions that's predispose the body to this thrombocytopenia. And as we have sort of done this out of sequence, the diagnosis in the diagnosis text for thrombocytopenia, if we suspect that thrombocytopenia, if we suspect a patient to be predisposed to this condition of thrombocytopenia, then a physical can be ordered, blood analysis. We examine the skin for these petechiae, red and purple and brown spots. We examine the body for continuous bleeding, or the signs and symptoms of high fever and nausea. There are also signs that is a sign of TP, or thrombocytopenia, but these signs not only occur in TP but also in other body abnormal conditions. A complete blood count and test to see if your blood is clotting correctly. And in some case, bone marrow biopsy can be done to diagnose this thrombocytopenia. So bone marrow fluid and tissue with a specialized needle in this bone marrow biopsy. Bone marrow fluid and tissue with a specialized needle, and examine it under a microscope for the abnormality. So that's the condition of thrombocytopenia, which is opposite to thrombocytosis or thrombocythemia. Once again, if we should briefly review what we have just said. In a brief review, what we have is thrombocytopenia, reduction in the platelets count, and statistically or mathematical count would be less than 150,000 platelets per microliter of blood, And we mentioned that leukemia, which is a cancer of the blood or the bone marrow, can lead to thrombocytopenia. Lymphoma, which is a cancer of the lymph system, which also affects the bone marrow, that can cause the reduction in platelets count, leading to thrombocytopenia. Aplastic anemia, which destroys the platelets, that can also affect the body system and causes thrombocytopenia. And man-made radiation and chemotherapy to destroy platelets, not only platelets, but the red blood cells and white blood cells. But we're focusing on the platelets in thrombocytopenia. So the radiation and chemotherapy destroy the platelets and causing a reduction in the platelets count. Viruses such as Citomegalo virus, HIV, Hepatitis, and the Epstein Barr virus, these viruses can lead to the case of thrombocytopenia. And we mentioned also immune thrombocytopenia, in which the immune system attacks the body, and that can also lead to thrombocytopenia. Enlarged spleen, which helps to trap the platelets and prevent the platelets from flowing through the bloodstream, that can cause also thrombocytopenia. Exposure to toxic chemicals. And we mentioned in the treatments, we have platelets transfusion and splenectomy, which is removal of the spleen, but this can also lead to other negative conditions, which can further causes a problem. So what we do sometimes is we vaccinate the patient with various vaccination to help prevent infections in the splenectomy process. So that's like a brief overview and review for the thrombocytopenia. So next we will look at, I've done thrombocytopenia, thrombocytosis, thrombocythemia. We have also done leukocytosis.